Oh, I would very much like that. I think in some extent we are already a global hub, only a very small one, because our student base, it's coming from everywhere. We have students from 5 continents, almost from all the different time zones. We have people from various backgrounds. GCLS as a school is in collaboration with some governments or regional governments, working on defining standards. We're working with clinics, trying to improve things, always being aware that we are just, an educational provider. So we're not doing the basic research. We're helping people to sort of discover what's out there and what's possible. And we are teachers and translators. And it's a fascinating thing. And I hope this is going to continue. There are currently some markets or countries that are very, very much invested in longevity medicine, longevity science. I hope there will be more of those, and we are happy to be involved with that. So, our conferences, it's like a traveling circus. We did one in Switzerland. Obviously, we did one in Dubai that is going to be repeated in February. Actually, I think it's going to be quite big. We are now having one happening in China where we are building this integrative clinical testing and training center. So I think this is going to be a fantastic. It's in China's second biggest hospital, super modern, AI driven with robots on the floors, and we will have one of a full floor to ourselves to give the opportunity to offer trainings to our doctors, to the students, but also run studies, etc. So it's looking amazing, and there will be many opportunities ahead. But of course, we are, just one school, small one. I hope there will be many others that go into that field. Well, I think, as I mentioned before, that we are sort of a translator or teacher. I think our job is not only to educate healthcare professionals, which we already do, but we also want to get in touch with those people that are decision makers, on a policy level, government level, or a healthcare level. It's important to create understanding for this revolution that is taking place. And I think we don't just need good doctors. We need the ecosystem that helps them or enables them to help patients. So therefore, we need to get everybody in line. We need the support of insurance companies, of course, of state insurance, and then a lot of discussions about advanced therapies and whether they should be allowed or regulated, and how about the supplement issue that I mentioned before. It's becoming a huge industry. Everybody is taking supplements. The question is, do they even need them? Are they safe? So I think it's super important, and this is a role that we can play as a trusted institution, and probably one of the more conservative voices in the field, because we have to stick to the Swiss academic guidelines. But at the same time, we try to remain very open to what's happening and remain interested, in new discoveries and new technologies and new applications of things. I mean, everybody's talking about stem cells and exosomes and peptides and whatnot. I think these will carve out their place. But of course, we are in a very early stage of discovery. So a lot of the data that we have is more anecdotal. So it's individual doctors explaining about their success stories with that. But we still lack the clinical data and evidence. And I think we can highlight this. We can help to sort of, together with industry partners, to build more opportunities in that space, and starting with education and research. So fascinating. It's going to be wonderful. And again, I just hope that there will be enough others chiming in that are interested in that, because there are wonderful, great educational brands out there, some of which we work together, and some of which I think still think about whether to go into that field or not. And I can just tell them they really should. Oh, I would like to actually integrate it already in schools. But when we talk about medical education, I think it's absolutely makes absolute sense to really integrate aging biology in year one, right? Starting at the very beginning, okay? Understanding this important process, or these processes, actually. It's probably a lot of different ones that you have to understand, that essentially, age our body on on a micro level, right? Not cellular, but even below that. And that is very important in order to then reframe medicine and medical intervention around prevention and resilience and maintaining function and maybe returning function, and not just crisis response. Because of course it's super important that we have great doctors if something happens, an incident, I don't know, a heart attack or so. But I mean, we really have to focus to prevent these things, because from a healthcare perspective, on a system level, we are reaching a point where we simply cannot afford to just to react things. We have to prevent. Investing work and money before something happens is in the end going to help us a lot with saving money. And unfortunately, when we talk about healthcare, we very often have to talk about money, because this is what people listen to, right? The decision makers, of course, they're happy if people are healthy, but eventually it's a question of money and when to invest it in order to reap the biggest benefit from a patient perspective. So I think we have an opportunity for that, but we have to get this into the minds of the doctors. And why not start with the study program? We have some good examples in Romania, for instance, at Carol de Villa University, where I'm also a visiting professor. And there was this wonderful initiative a few years back that every student has to take a course in longevity medicine. I think that is fantastic. We need that everywhere.